Hi there, this is Heather Barrow from Food for Life, and you are listening to Radio Kidnappers, the voice of Hawke's Bay. And I am the host of Food for Life, but today I have a special guest in the studio, and this is Morkel from ProActive Rehab. Hi, Morkel.
Hello, Heather. Thank you so much for having me.
Of course. It's a real treat to be able to interview someone on the show. So in case you're listening and you don't know, Morkel is from ProActive Rehab. ProActive is a rehabilitation clinic. They have several locations throughout the Bay. One being in Napier at the health center on Wellesley Road, right?
That's great.
Another in Hastings on Mariah Kakaho. And the last one in Taradell, where my clinic is, on Lee Road. So if you're listening, Morkel, if you just want to tell us a little bit about ProActive, what it is, when it was established, what your role is.
Sure, thank you, Heather. So ProActive is a rehab and well-being company, wellness company, like you said. We are nationwide, but in the Hawke's Bay we have 3 locations, so Hastings, Napier and Taradell. And we have a few services that we offer. We have physiotherapists, occupational therapists, as well as nursing services and psychology services that we can offer in the Bay Area. So we deal with your normal musculoskeletal injuries. That would be your rolled ankles, lower back injuries, sports injuries, as well as vocational rehab services, pain management services, concussion services, as well as social needs services that we cover with our team in the Bay. So
it's like a one-stop wellness shop.
We try to cover all the bases. Yes, and we have a great team in the Bay.
Excellent. Well, I know I've been working with ProActive for a number of years, and I've really enjoyed working with the clients that you do send my way. It's a great relationship, and you might be listening and think, well, what does rehabilitation and nutrition have to do with each other? Well, we've definitely found over the years a heck of a lot.
Yes.
When we talk about, we're both very holistically focused, as you just covered all those areas that ProActive looks at.
Yes.
I'm also a holistic nutritionist, and I like to look at all those different areas as well to eventually, with the same goal, to get our clients back to full health and well-being and recovery.
Yes. Yeah, so ProActive is founded on the 4 corners of health approach, which is mindset, function, sleep, and nutrition, that we're going to talk about a bit today. So we realize that whenever we're dealing with a patient's or a client's need or an injury or a recovery process, that you have to look at all 4 corners, all 4 aspects, and we cannot isolate one area and forget about the rest. And that is why we are really privileged to be able to work with you in Hawke's Bay and really to get the best service for our clients when it comes to nutrition and help with their rehabilitation and recovery needs that they have during the process.
So can you just give some of the listeners some examples of what kind of clients would come through your door? Where do they come from? Can they come off the road or?
So we often have guys coming in off the street, so where they will come in with sports injuries or maybe an injury they sustained at work or home, and that can range from anything that will involve shoulders, hips, lower backs, knees, and our physiotherapist will be able to deal with that in clinic. We also have services like vocational rehab services, and that is more focused on getting clients back to work following an injury. So that will usually involve the services of our occupational therapy team as well, who will then get in contact with the employer and the client and try and work on a plan that will give us a safe and sustainable return to work following injury. We also have concussion services where we help patients following head injuries or concussion to rehabilitate and get back to function. We have a neuropsychologist on our team that helps us with those needs. and we can probably talk a little bit later on how important nutrition is also for those clients. We also have a pain management service. We try and help clients that have had long-standing issues with chronic pain. Again, to look at all the aspects that may be involved in that process, like sleep hygiene, nutrition, function, and mindset, and try to give them strategies to overcome that as well.
Right. Wow, that's quite a collective team you have of specialists working there. So you might be listening and be thinking, well, I have had this niggle in my back that's been shooting down my legs, and I'm starting to get headaches and not quite sure where to go. Is it an ACC referral? Who knows? What would you recommend to that person listening?
I think a good place to start would probably be to, if you haven't yet been to your GP, maybe to consider going there if the source of your pain is maybe unknown, and you just want a bit of clarity around that. If there's an injury or a local issue to a joint, you can also give one of our clinics a call, and we can maybe just try and get a little bit more information on the phone, and maybe by looking at the specific case and the circumstances around that, we will be able to give the client a little bit more information as to what the best route would be to take to get it seen to. So, yeah.
So it could just be you're having a bit of pain at home. You're not sure ACC will cover it, but they can just walk in, make an appointment, or call the clinic, make an appointment, and then you can assess whether this could be done, an ACC claim or not.
It would it would be good to just discuss it and just to based on the facts around the injury or the pain, to give some advice as to what would be the best way to go.
Right. Okay. Very good. So there you go. If you're listening, why not give one of the 3 ProActive clinics a call in the Bay? Yeah. So what would you like to talk about first? I know there's a lot of areas where that's one of your pillars is nutrition.
Yes. Yes, nutrition is, like you said, is one of the pillars, one of the what we call the 4 corners that we base our whole approach on with looking at clients. And I think probably a good place to start would be just looking at injury recovery and how important nutrition is in that. So we all know that we need certain things in our bodies to help it heal, and I think it would be really good to maybe just elaborate on that a little bit. So following an injury, be it a sports injury or maybe a fracture, things that will be important to keep an eye on and to incorporate in one's diet. Right.
Okay. Well, that's over to me here. So, nutrition for injury recovery. So, normally if there's some kind of injury or trauma, there's inflammation in the body, there's pain, obviously, and of course that affects, the entire body, really, the nervous system and sleep and everything else. But if we're specifically talking about, tissue repair and growth and wound healing, obviously there's certain nutrients that are really important. Probably the first one being one of the macronutrients is your protein intake. So obviously now's not the time to go on some strange diet that says you need to be eating so many grams of protein per day. Making sure you're getting enough protein to help minimize, the loss of muscle, and, to build the muscle up for strength recovery is really, really important. Increasing your muscle mass, especially for, if it's a sports injury, you're trying to get back out there to train. With damage to tissue, there's always inflammation, and of course we want to be looking at omega-3 properties, your strong anti-inflammatories. So there's some great supplements out there for such as different fish oils that I would recommend, but also being a nutritionist, I always like to go to food first. So you'd be looking at your omega-3 rich foods such as your fatty fish like salmon, wonderful source, your sardines, even anchovies, walnuts, flax seeds. All those are really good sources, and even different oils, flaxseed oil is great, and fish oil, like I mentioned. Yeah. Specifically for wound healing, zinc is very, very important. for tissue repairs, and a lot of people are very deficient in zinc. We use up our zinc stores every day, so you want to be looking at pumpkin seeds, sunflower seeds, chicken, ginger, certain meats. Of course, this isn't applicable to everyone. You know, some people maybe shouldn't be having too much red meat for another reason. You can always come see me, or even at G's Pharmacy where I work, and get a zinc test and see if you're deficient in zinc. And supplementing is also a really good idea.
Yeah, that's great. And the role of vitamin C in wound healing and injury recovery, is that really important?
Absolutely, vitamin C. Yeah, we use up vitamin C stores every day in large quantities. So I think even with the coronavirus going around, I noticed zinc and vitamin C started to be heavily depleted from certain pharmacies and even from supplemental companies I was ordering from. So vitamin C, absolutely. And the obvious ones are citrus fruits, you know, your oranges, lemons, grapefruits, limes. Believe it or not, broccoli is quite high in vitamin C. Okay. And another great source is red capsicum. Okay. So even combining those together, you know, iron aids the absorption of vitamin C. So put those together and you have a good meal.
That's great advice.
Yeah.
That's awesome. And then something we also tend to see in our clinics, there's patients who suffer from concussion for various reasons, be it work-related or sport-related. Do you have any advice around that, around nutrition specifically for injuries involving the brain and the nervous system?
Yeah, absolutely. I mean, I'll admit I haven't seen too many concussion patients over the years, but concussions are serious, you know, can cause serious brain injury and trauma. And of course your brain is, you know, it's a muscle, and it actually consists of a lot of fat and a lot of water. So what I've already mentioned before, again, inflammation, omega-3s are very, very important. So if you've experienced a concussion, I definitely recommend getting on a good quality fish oil, such as Ethical Nutrients or Nordic Naturals. A clean fish oil, preferably. The more money you pay, the better quality when it comes to fish oil, unfortunately. And a lot of nutrients become depleted with concussion. So, you know, vitamin C, vitamin D, vitamin E, a lot of the antioxidants, magnesium, zinc again. So I definitely would recommend a good quality multivitamin as well, just to make sure you're covering all the bases. You don't know how that injury is going to affect your appetite and your food choices, so you might as well at that time have a good backup plan, get on a good multivitamin. The one that I would suggest, because there's so many out there, is a supplement called Vitamin Code, and they can specialize that for men or for women, and also according to your age. So if you're over 50, it will have a little bit extra of some of the other things that you need.
Okay, great. Yeah. So that's more individualized for the specific person. Oh no, that's great advice.
That's just a few things. I can say a few bits more on the concussion, but. Also, your protein intake, again, very, very important. So you want to be looking at, you know, getting about 1 gram of protein per kilo of body weight. Now's not the time, again, to go on a specialized diet. You know, your brain needs repairing, so you want to give it the right tools to be able to do that. And of course, antioxidants are very important for recovery from concussion as well. So there's lots of great antioxidant formulas out there. So vitamin A, vitamin C, vitamin E, resveratrol, all good stuff. Green tea, turmeric. Okay. Yeah.
So a good few natural options that you have there. You mentioned the need for a good quality omega-3 supplement earlier, especially derived from fish oils. What should people be looking out for when they're purchasing an omega-3 supplement? Is there something you can see on the label, or something you need to look out for in terms of how it's sourced or where it's from? Is there some advice you can give us around that, maybe?
Yeah, absolutely. So you want to make sure it's an ultra clean source of fish oil. Looking at where it comes from is also really good. So I think the one, Bioceuticals Ultra Clean EPA and DHA is another great one. That's something that you look at, is the amount of the EPA and the DHA, which are the properties of the fish oil that have the anti-inflammatory benefits. You at least want, I mean, some people might say a bit different, but you at least want 600 milligrams of your EPA and your DHA for good quality fish oil. Oftentimes you won't find that in one capsule. You might need to take 2 or even 3 a day.
Okay.
But talk about if you're listening now and you haven't had a concussion and you're just thinking, well, I actually have a lot of problems focusing and concentrating on memory. Yeah. Fish oil is fantastic.
Okay.
Carry a bottle in your bag. Take it throughout the day. Right before an exam, if you're a student out there, take a fish oil.
It's
really going to help.
Good go-to supplement.
Yeah, but you do want a clean one. You don't want one. Fish oil is known to have a lot of mercury in it. Yes. So one that's ultra purified, or it says ultra clean. Normally you're paying about $35 or more for a good quality fish oil, not $20 for that gigantic jar of 300 fish oils.
Okay. That's good advice. And what, in your opinion, Heather, how would that sort of feed into things like mindset and sleep, having good, not just fish oil supplementation, but just good nutrition? Is that quite important in affecting your sleep and your mindset as well? Those 2 aspects.
Yeah, well, as you know, it's all interlinked, isn't it? It's all intertwined. We're talking about muscle injury or, wound recovery. It's going to impact your nervous system, which is going to impact your sleep. It's going to impact your gut health, your absorption of nutrients. So, obviously with sleep, we need magnesium, we need calcium, we need different hormones. We need dopamine and serotonin to help us have a peaceful night's sleep. So absolutely what you eat, paying attention to your gut health, your digestive health, all of that when it's supported properly will impact your sleep, which of course is going to impact your mood and everything else.
Yes. Yeah.
It's all interlinked.
Yeah, we realize as physiotherapists that you can't look at just one aspect.
Absolutely.
Like, we will tend to focus a lot on function and the physical manifestation of an injury, but you realize really quickly that it's a whole person that you're dealing with. And the idea behind looking at mindset, function, nutrition, and sleep as a holistic approach, the aim behind that is to try and empower the client, to empower the individual, to show them that they can take control over their life, and they are able to help facilitate a healing process or a recovery process by empowering themselves and looking at what they eat, looking at rest, looking at their mindset. And I think that is an important place to try and get to, rather than trying to look for external fixes for a problem. Rather have that focus of how can I empower myself to move beyond this. Absolutely. I love that nutrition is one of your 4 pillars. And you're right, to really, I think, help the clients, we need to look at their mindset, and we need to ask these questions about their lifestyle and their background and where they worked if they're not working now, what they've been exposed to, what their stress levels are like. Do they have a lot of kids at home? What is their opinion about food? Do they approach food as a mechanism to support their emotions? And really get behind that so that they can begin to understand actually the role of food and the function that it plays in the body. Yes. So that, as we talked about before, when they're home and they need to make that right choice of what to eat to help with their recovery, they're making the choice because they know that this is going to help heal them. Yes. Let food be thy medicine and medicine be thy food, right? Yes. Yes. And that's a responsibility that everybody needs to take for themselves when they are not being watched, when you walk into the kitchen and you need to know what the right thing is to do. That's right. and without being told. Because it's easy to do something when somebody's watching you and guiding you, but to get to that point where you know why you have to do it and why it's good for you. I think that's really important to reach that point. I think that ProActive does it, and so do I, and I think that's why we like to educate as well and spend time educating and not just
asking questions and saying, you need to do this, explaining. You know, I explain the digestive system, why it's important that you need to break your food down well so you can absorb nutrients so your cells can get fed. You know, recognizing ingredients, not recognizing ingredients. What does that do to the body? So I think, education's hugely important, and I think we're both really focused on that, which is great.
Yes, it's very important. It's one of the main focus areas when we start dealing with patients and clients right from the get-go, for them to understand, number one, what happened to them, what the injury is, what it entails, what the healing timeframes are, what the impact will be on their function, what the impact may be further down the line in future, and then to build on that and say, well, what can we do now from the onset to try and get healing happening, to try and facilitate the recovery process. But to get that process going, that ball rolling, you really need to be educated on what's going on to make the right choices.
Right.
So that is extremely important.
I didn't actually ask you, what do you do at ProActive? What is your role?
So I'm a physiotherapist, and I'm based at the Hastings and Napier clinics. I'm involved primarily with musculoskeletal physiotherapy, so that will, for the listeners, that will pretty much be the normal things that you would think you would go and see a physio for, like lower back injuries and sprained shoulders and ankles and knees, sports injuries. I am fairly involved in sporting injuries as well as vocational rehab services. So getting patients back to work following injury. So that those areas would be my main focus. Okay. I have clinicians working with me in the clinics as well that tend to specialise more in other areas, like concussion and pain services. So we all have, I think, a good baseline knowledge.
You all have a specialty.
And then we tend to have our little focus areas. We tend to spend a little bit more time in. So that's pretty much what you do.
Excellent.
Yeah.
And what would you say? Do you ever have clients come in and they're on, a long list of medications, and you think, oh wow, what are we gonna do about this?
That's always a difficult one, because you get clients that have had pain or an injury for a really long time, and together with the pain medication, they also have maybe some other health conditions that also require medication. And it's always important to take note of that. It's obviously not our role to try and educate them on medication and when to stop using certain things and when to try other alternatives. But it is always a good idea to just get the client to go and see a doctor or somebody that specializes in that area and that's knowledgeable, to just look at that aspect as well. Because as you well know, medication will also have certain side effects.
Absolutely.
And long-term use of medication will cause certain issues, and to get the right professionals involved to then educate the patient on that is really important.
And you have a clinical pharmacist that you work with as
well? We work with a clinical pharmacist as well. So in cases we want some expert advice and feedback regarding these cases, we will refer on to her for some guidance.
Excellent.
Yeah.
Wow. So there's so much more we could be talking about, but I think we've covered quite a bit. It is amazing to know that services like ProActive are out there, helping people back to work, helping them with their injuries. Really caring holistically about the entire person, about their mental health, psychological health. I think it's fantastic. So. If you could just remind listeners where ProActive is located, and if they want to come see you, where you are located.
Yes. Yeah, I can also just add, Heather, we also quite interested in getting onto injuries and problems early on. So
Yes.
if there are any companies or employers out there that would like us to stop by and have a look at their place of work, we are more than happy to do that and go into a partnership with them and see if there's something we can do to get an early intervention service going if there should be injuries at work. They can go onto our website, so it's proactive4health.co.nz. In the Bay we have 3 clinics, so the one is in the Napier Health Centre on Wellesley Road in Napier. The Hastings branch is in Moriokoko Road in Hastings, and then on Lee Road we have the Taradale practice. So they are welcome to. They will find our telephone numbers on the website if they would like to contact us.
Excellent. Oh, well, thank you, Morkel. Thanks for coming on the show and being a guest. And yeah, I think it was great for listeners to hear about ProActive and everything that you do. And if you're listening, this is Food for Life, and I'm Heather Bear. I'm a registered clinical nutritionist, and my clinic's located at G's Pharmacy in Taradale. If you want to get in touch, my website is food4, this time it's spelled F-O-R, life.co.nz. My number is 027-812-5071. So thank you very much for listening, and thanks again, Morkel, for coming on the show.
Thank you, Eda. Really appreciate it. Thank you.